So thank you so much. My name is Diana Garrett. I'm a physical therapist here at Performance Therapy at Providence St. John's Health Center. The primary focus is for breast cancer rehab, and I'm just going to talk to you about how we can get more physical activity and the benefits of it. So, some of the things that we're going to touch on today are we're going to review some of the possible side effects from breast cancer treatments, discuss the positive benefits of exercise, provide some recommended guidelines for physical activity specifically for the breast cancer population, examine some of the effects of physical activity, and then present some examples of how to integrate it into your activities. So, one study has shown that among 800 breast cancer patients interviewed, their overall activity levels have decreased by 2 hours after their diagnosis, which is a significant amount of time kind of spent away from getting some physical activity. And approximately only 20 to 30% of breast cancer survivors are meeting the public health exercise guidelines after their treatment, and only 5 to 10% meet the guidelines during their treatment. And what the American College of Sports Medicine has shown that exercise is very important for both cancer prevention and during their treatments, specifically for those seven common types of cancer, breast cancer being one of them. So some of the possible treatment-based side effects that we can see and how exercise can help with that. So the main complaint that I hear people saying is that they're just so fatigued. And cancer relating fatigue is different than just being kind of tired and overdoing it or not getting enough sleep. It's this persistent sense of being tired or exhausted that's related to the cancer and its treatment. It's reported about 70 to 100% of patients and can last for months to years after finishing your treatment. This may be due to anemia or the chronic inflammation from some of the treatments, depression, altered metabolism, impaired nutrition, or the side effects specifically from medication on the central nervous system. So, a little counterintuitive, but exercise can help with fatigue. Typically, when we're tired, we think, oh, we need to lay down and take a nap, but exercise can actually have a bigger benefit towards your fatigue levels. We think that what happens is during cancer related fatigue, the delivery of oxygen to the cells decreases, which limits the amount of energy that can be created. This causes the heart and lungs to have to work harder in order to sustain adequate oxygen supplies to the cells. When we exercise, we actually increase the delivery of oxygen to the cells, which allows for more energy to be converted. So exercise is thought to decrease fatigue by decreasing neurotoxicity from treatments. It kind of helps get things kind of flowing around, get those toxins moving, and decreasing the chronic stress that affects a particular part of your brain, which can help re-regulate your body. Another side effect from cancer treatments might be pain. This might be due to radiation or surgery or chemotherapy. There's two main types of pain: nociceptive pain, which is typically pain to the skin or the muscle, and then neuropathic pain, which is actual damage to the nerves. Exercise can help alter the central processing of pain. So it kind of reroutes your brain into thinking, oh, this isn't quite so painful. It kind of slows down those signals that are sent to your brain. So you can actually trick your brain into thinking that there's not that much pain. That'll help you kind of increase your activity overall. Studies have shown that combined training, which includes aerobic, getting your heart rate pumping, and resistance exercise, which is typically kind of weights or bands, and we'll talk about that later, decreases pain in breast cancer survivors. And it's also been shown to decrease some of the symptoms of chemotherapy-induced peripheral neuropathy, which can occur when kind of the sensory nerves are damaged in the hands or feet. Another side effect that we see is sleep disturbance. So it can be either difficulty falling asleep, maybe you wake up too early, or you can't stay asleep, or you just don't feel restored. Like you get a full night of sleep and you're still tired. This is reported in about 30% of patients, and some patients use medication to improve their sleep. So you can use medication, or again, you can try exercise. So a study in 2015 showed that moderate intensity walking can significantly improve sleep in cancer patients. What we think is that exercise kind of reprograms your sleep-wake cycle. If you've ever taken a long flight and you get that jet lag, that's when your sleep-wake cycle is kind of altered. And so exercise can help improve the quality and your total time of sleep by kind of reprogramming your body. And some studies have shown that exercise can lead to an increase in blood flow to the skin, which causes a rise in body temperature that promotes sleep. That's why, taking a warm bath before going to bed can kind of help you fall asleep also, because you kind of increase your body temperature, makes it a little bit more sleepy on the inside, and kind of helps promote that sleep wake cycle. Another side effect that we've seen are cardiovascular changes in cancer survivors. This can occur due to the effects of some chemotherapy medications. We've seen actual changes in the heart structure where there's decreased stroke volume or increased resting heart rate or a decreased ventricular mass. Or we can see it with altered levels of red blood cells or your platelets. Exercise can stress the heart and in positive ways, in great ways. So, acutely, so in the moment during exercise, the heart increases its cardiac output, the overall blood that's pumped by the heart. So, when you're exercising, there's just more blood flow that's going through your body. It also increases your stroke volume, so the amount of blood with each beat. So, every time your heart is beating, it's increasing the output, and then overall, it's already increased. And what we see with continued exercise training is that we actually see an increase in those red blood cells, an increase in the hematocrit, and an increase in the hemoglobin. Aerobic exercise can increase the heart's ability to pump blood per contraction at rest. So it kind of just makes your heart overall more efficient and more effective. Another big side effect that we see with our cancer patients is a suppressed immune system. So we'll see some lower numbers of white blood cells, or just that the immune cells aren't as kind of robust and strong as they used to be. Exercise can actually increase some of the specific immune cells that are created, your natural killer cells, your monocytes or granulocytes. And also decreases the duration of neutropenia. So the time that when your immune cells are at the lowest, that duration shortens. Um, a study involving breast cancer survivors showed an increase in the immune cells following a 15-week aerobic exercise routine. So, getting their heart rate going up has shown to increase your immune cells overall. And if you look at this chart on the side, the bottom line is the intensity, and the vertical line is the risk of infection. So, what we see is that when someone is sedentary, when they're not moving very much, they kind of have an average to higher risk of infection. When you kind of go into that intensity into the moderate, you get even lower risk of infection because all those immune cells are being more robust. And then if you go too far, if you go too high of your intensity and you really tax your body, then your risk of infection can go up actually higher. So we want to find that good kind of moderate intensity to help promote the immune cells. And of course, we see some musculoskeletal changes with cancer treatments. We might see a decrease in lean body mass, decrease kind of muscle mass. We might see an increase in fat mass or some weight gain or some bone density changes. And of course, exercise helps with all of this. In terms of bone, exercises, weight bearing exercises have shown to significantly affect the density in both the femur and the spine. And moderate intensity exercise has lessened bone loss in breast cancer survivors. So it's important to get some of those weight bearing exercises, walking, anything where you're making a little bit of some impact through your body will help improve your bone density. And in terms of muscle exercise, of course, is going to increase your muscle mass and kind of the capability of the muscles to generate a lot of force, so increased strength. And this is due to increased tissue pliability and flexibility. All the fibers are kind of just improving and contracting a little bit better. And interestingly enough, there's a study out there that showed that adults with greater hand grip strength have a 31% reduced all cause mortality risk. So, whether it is heart disease or cancer, it seems that adults with a greater grip strength, which is supposed to represent kind of your overall strength, actually have a reduced mortality risk. So, just a little recap: the benefits of exercise increases your aerobic fitness, makes your heart work more efficiently, increases your muscular strength, improves flexibility, can improve your body composition. We want more of that lean body mass and less of the fat mass. Can improve your quality of life, increases your immune response, decreases your pain, improves your sleep, and improves your cognitive function. Oh, and improves your treatment tolerance. So, one thing, just physical activity can help with all of those aspects, and it's pretty great. So, there's some things that we want to kind of avoid when we're talking about exercise. We want to avoid inactivity. So, we want to keep moving. You want to consider your prior exercise history. If you never ran before, I don't think it's very wise to be like, I'm going to run a marathon right away. Let's start with a walking program. Let's work into jogging. Let's kind of build things up incrementally. We want to allow for appropriate healing after surgery. So you always want to be cleared by your surgeon. You don't want to exercise with extreme fatigue or any anemia. That can increase your risk for kind of some musculoskeletal injuries. You want to consider your immune function. If you have a low immune system, you might want to avoid a really crowded gym, especially during COVID. We can kind of modify some things to make sure that you're exercising in a safe environment. And you always want to consult your physician prior to starting an exercise program. So we make sure we start at the right intensity level. So, a couple exercise guidelines and how to incorporate it into your physical activity. So, the main exercise guidelines that were put out by the American College of Sports Medicine and the National Cancer Institute are that you want to get moderately intense aerobic activity, 30 minutes a day, 5 times a week. We're aiming for 100 to 30, 300 minutes a week. Or you can do vigorously intense exercise for about 20 minutes a day, 3 times a week. So working a little bit harder, don't have not working quite as much in terms of frequency, but getting the same effects. We also want to add 8 to 10 strength training exercises, 8 to 12 repetitions twice a week. So you want both the aerobic activity and the resistance training. I know this kind of seems like a lot, 30 minutes a day, 5 times a week, but it doesn't have to be all at the same time. You can kind of do it in intervals. You can do 10 minutes here, 10 minutes there, and 10 minutes at the end of the day to get up to that 30 minutes. But if you have the time to get that 30-minute chunk out, go for a great walk. That's kind of the recommendations that we're seeing now. So, what is moderate activity? So, moderate activity is where you're working hard enough to raise your heart rate, get a sweat on, but can still carry on a conversation. If we go by our heart rate, we're looking at 50 to 70% of your maximum heart rate, and we'll go over how to calculate that. Vigorous activity is more intense. It's harder to carry on a conversation. You might get some words out, but saying long sentences are going to be a little bit more difficult. That's where we're going to target our heart rate at 70 to 85% of our maximum. In order to monitor our heart rate, you can use a Fitbit or an Apple Watch, or you can take your pulse by placing your index and your middle finger on the thumb side on the inside of your wrist. And you don't want to use your thumb to get your pulse because you actually have a pulse in your thumb and it'll get kind of confusing to count. So you want to use your index and middle finger on the inside of your wrist towards your thumb. And you're just going to lightly press so you can feel that pulse and count it for 30 seconds. And then you multiply it by 2. And that's how you get your heart rate. I love heart rate trackers because they're just a little bit easier. You can just look down at them and they're constantly monitoring you. So it's just a little easier to use a tracker, but you can definitely still take your own heart rate. This is a nice chart, so you can kind of look to see what your target heart rate zone would be for that moderate to vigorous activity. So if I am 45, if I look into the chart, my average maximum heart rate is 175. But if I look at my target heart rate zone, it ranges from 88 to 149 beats per minute. So, how many times my heart beats in 1 minute. If I'm looking at doing more of that moderate intensity, I want to stay down to that 50 to 70%. So, I want to stay closer to that 88, maybe to 100 beats per minute. I'd have to calculate the percentages exactly. But if I'm looking at more of that vigorous activity, I'm going to kind of target more into that 149 beats per minute. So what you can do is kind of just take a look, kind of see where you are closer to, into these age increments and see about where do you want your target heart rate zone to be. And you want to kind of waver in between there. And some examples of different intensity levels. So a light intensity might be a leisurely bike ride, taking out that beach cruiser and just kind of riding along the beach, maybe some slow, light walking, some light housework or Tai Chi. Some moderate intensity is you're going to kind of get on that bike, but you might get some hills going in there. So you're kind of having to push a little bit harder or push a little harder with your walking. Gardening is a great one. They say it's moderate intensity, but I've seen my mom in the garden. I think sometimes I can be a little bit more vigorous depending on how many weeds she's pulling up and digging up some trees. So that can waver back and forth. Again, if you want to go base more on heart rate, that's a really great benchmark to use. And then vigorous activity is biking faster than 10 miles per hour, kind of walking very briskly, like you're kind of in a race, or jogging. Some fast dancing is really great, or some high intensity yoga or Pilates is more kind of along that vigorous line. So strength training. There's various types of strength training, and you can use a whole assortment of different types. You can use resistance bands, which you can get anywhere. Weights. If you don't have weights, you can use water bottles, canned goods, a bag of flour. I got a couple bags of rice at home that I kind of toss around to use for some exercises, or you can use your body weight. Some general principles are, you don't want to start with heavy resistance. You want to slowly build up. The best thing about using water bottles, if they become too heavy, you just drink some water and you get some hydration going. So you can always kind of vary things that way. We want to aim to perform 2 to 3 sets of 8 to 12 repetitions. So if I do some bicep curls and I do 8 repetitions, I take a break, that's 1 set, and I go again and do 8 more, and that's my second set. We want to target some large muscle groups, your gluteals or your butt muscles, your core, which are your abdominals, your quadriceps, the front of the thighs. We want to work our backs. We want to work our shoulders and our chest. We just kind of want to target kind of bigger areas. So some great examples are just standing up and sitting down. This is a squat. You can kind of make it harder by starting standing and sit back to touch the chair. Pretend like the chair is really hot. So don't put all your weight down and then come right back up. This is going to work a lot of your leg muscles, your quads, your glutes, your hamstrings. And you can add things. If it's too easy, hold on to something that's a little bit heavier, or go from a lower seat. A lower seat's going to be much harder than going from a higher seat. Push-ups are a great exercise for your upper body. You can do things with modifications. There's a picture of this lady here who's doing a push-up on a wall. Some surgeons might say not to do push-ups because of, if you have some implants that are in, they don't want you really overworking your chest muscles. So you can modify some things, of course, with their permission, of just kind of the placement of your hands. If you keep your elbows wide, it's going to work more of your pec muscles. If you pull the elbows into your side, that's going to work more of your triceps. It's similar to a chaturanga in yoga. So those are some modifications you can use to work kind of different muscle groups, just based on kind of angling your arms, but always making sure that it's okay with your surgeon. And, you could start your push-ups on the wall, which is less demand, and then work towards kind of a table height and kind of working your way down towards the ground. And even on the ground, doing push-ups off of your knees versus your feet can really kind of change the stress that you're putting on your shoulders. The next exercise is bridges. I personally call them Jane Fondas because that's what I think of. But squeezing your tush and lifting your hips up, this is a great exercise for strengthening your glutes and your hamstrings. And you can make different changes by putting your feet on a coffee table or a sofa, kind of elevating your legs, maybe putting your shoulders on the coffee table and your tush on the ground. So you're having to move more through a greater range. You can do them on 2 legs. You can do them on 1 leg. You could do it on 2 legs and lift 1 leg off. There's so many different variations that you can do that all target the glutes and the hamstrings. And then we have our arm exercises: an overhead press or bicep curl, triceps, bent over rows, reverse fly, where you bring your arms out towards the sides. And you can see in this last picture, she's using 2 water bottles, which is great. They're about 1 pound each. Get the larger ones. Those might be 2 pounds. If they're too heavy, take a drink from each, kind of make sure that they stay even. But it's a great way to incorporate some upper body strengthening into your programs. Some special precautions that we want to take: you always want to consult with your doctor before you start a new exercise plan. They might give you some insight into things that they might be more beneficial to your specific medical status. And some things that you might want to consider, what that might affect your exercise, is if you have some poor balance or unsteady walking. You don't necessarily want to do, walking on surfaces that might make you lose your balance and fall. So want to keep in mind of kind of where you're at and where to start at. Severe anemia, again, it's those low red blood cells. So we want to make sure that you don't over fatigue your body. Infection. If your body's fighting off an infection, we want to conserve the energy for that fight and not overexert yourself. But like we said before, the immune system actually responds very positively to exercise. So you might just want to modify the intensity. If you have an active infection going on or you're fighting off a cold, you don't want to push too hard in your exercise. Go more towards that light to moderate intensity to kind of boost the immune system without overtaxing it. Poor bone health, that can affect your impact. Doing a lot of jumping is great for bone health, but if you have poor bone density, we don't want to risk overloading the bone. So you want to kind of watch that. Peripheral neuropathy, so the numbness and tingling that can be in the hands and the feet after chemotherapy, can really affect your balance. If you can't really feel the ground because of the tingling, then you want to be careful about what you're doing in terms of your exercises so you don't risk falling. And then the last condition is uncontrolled heart or lung disease, which hopefully, if you're following up with your doctor, everything is under control and you're being monitored, because we don't want to put undue tax on those systems. One area that I get asked about all the time is lymphedema and how does that relate to exercise, specifically for the breast cancer population. So, the lymphatic system is your transport system in your body. It collects excess fluid and proteins, carries them back into the bloodstream, and kind of just keeps things circulating through your body, especially your immune cells, protein, and all those larger things that don't necessarily fit into your circulatory system. Swelling can occur when there's either an increased amount of fluid or when the normal drainage of fluid is disrupted. So, an increased amount of fluid might come from a local infection because you have this inflammatory response, or um, your body gets a little overwhelmed. So, there's a little bit more lymph fluid into the area, or the drainage of fluid might be disrupted if there's a blockage from, say, scar tissue, from radiation, or scar tissue from surgery, such as when they remove lymph nodes. So these are some things that we want to consider and keep in mind when we're exercising. In terms of lymphedema, the gold standard for treatment is complete decongestive therapy. So this will include manual lymph drainage, which is a type of massage to kind of stimulate the lymphatic system and kind of redirect the lymph flow into non-taxed areas. Compression bandaging or using compression garments, so using some sleeves. And exercise. Exercise is a huge component of lymphedema management because exercise has been shown to help decrease the overall lymphedema, but also prevent lymphedema from occurring. So, some studies that are out there have shown that aerobic exercise, so the exercise that gets your heart rate going, of moderate intensity and high frequency, so doing moderate intensity a lot, increase their frequency, provides the most positive effects for lymphedema in treatment and in prevention. So, getting those brisk walking exercises going kind of helps pump the muscles and can help pump the lymph, to get things moving a little bit more. So, it helps in terms of the treatment, but also in preventing because you're keeping things moving and not getting it stagnant. Some other studies have shown that resistance training, so using the arms, lifting kind of light to moderate rate weights, is considered safe for those at risk or with lymphedema. The days of saying, don't lift your purse just in case because of that arm are over. We want you to use those muscles because as you contract those muscles, they pump and help stimulate the lymph system. And some of the research that's still being just concluded right now. So we're not quite sure exactly how much, but there's a potential to decrease the risk of developing lymphedema as you increase your resistance training. So just some clinical pearls for exercise. We want to slowly work up to building your tolerance for 30 minutes of aerobic exercise. So that's where that 10-minute increments 3 times a day or 15-minute increments twice a day, you want to build up to getting that at least 30 minutes of aerobic exercise a day. If you feel pain with the exercise, stop. If you have soreness afterwards, that's okay. Soreness may develop 24 to 36 hours after activity, and that's completely normal because you're challenging your body, but you should still be able to complete the normal daily tasks. We don't want to be exercising so hard that now you can't go down the stairs because your quads are so sore. We want it to be like, oh, I can feel that I worked that muscle, and that's okay because that soreness will subside. If you become dizzy, lightheaded, have any difficulty breathing, or feel nauseous when you're exercising, you should stop. You should always consult your physician if you're experiencing any of these symptoms while you're exercising, because it might be too taxing for your body, or it might be a signal that something else is going on. You always want to stay hydrated when you're exercising. Always want to avoid inactivity. We want to keep moving. And if you're unsure where to start, you should consult a physical therapist like myself. Physical therapy is not just for if you have an injury and need to rehabilitate. Physical therapy is also great for exercise guidance and overall wellness. We're experts in movement and we like to see people move and we want to get you moving. So if you have any questions about where to start, you can always ask one of your physicians to send you a referral to physical therapy, and they can do a full evaluation as to where you're at and help kind of create an exercise program with your goals in mind. So just want to say thank you very much. This is my email, diana.garrett@providence.org. So if you've got any questions for me, please do not hesitate to email me if something comes up after this program. And it has been a pleasure speaking with you. These are all my references. So there's a lot of science and research out there that supports exercise in terms of breast cancer. And we just want to keep you moving.
Thank you very much, Diana. This was great. I'm Becky Crane-Okada for those came in a little bit later. This is now our time for you to ask any questions. If you want to speak, just unmute yourself and Diana will respond, or you can put it in the chat. Any questions for Diana? That was great, Diana. Diana, do you want to just give the phone number for performance physical therapy? And do patients, I'll ask you a question, do patients need a prescription to see you?
Yeah, so patients do need a referral from their physician. It could be any physician or nurse practitioner or a physician assistant to come in for physical therapy. It'll be covered underneath your insurance. Here at Performance, we accept all PPOs, Medicare, and I know some HMOs. I'm not quite sure which networks specifically, but our front desk always knows. Our phone number here is 310-829-8724. Yeah, and more than happy to help out. Love to get you moving and keep you moving.
Hi, Diana. Thank you so much. This was super helpful. To clarify, do most folks come in for physical therapy post surgery, post radiation? What's typically recommended?
Honestly, I see patients throughout their continuum of care. I've seen patients after their surgery. I've seen patients during their chemotherapy to kind of keep up their strength and mobility. I've seen patients during and after radiation for mobility. So it's kind of wherever it fits in best for you. I feel like there's always something to work on. I feel like I could go to physical therapy for numerous things right now. So kind of whatever you feel comfortable with. I think with the research that's coming out specifically about keeping active during chemotherapy, I think that can be a little daunting for some people trying to figure out how to do it by yourself. So I think coming into physical therapy during that time can be extremely helpful because you're in a safe environment, you're guarded, there's someone always watching you to make sure that you're responding well. So, really, anytime during your treatments, physical therapy can be helpful.
Thank you. I appreciate it.
Thank you. Good questions. Any other questions from those on the call still? We're really trying to encourage our patients to see Diana, or Carol is the other physical therapist that works with a lot of our patients for what I call a fitness or wellness eval. I think we've had this mindset that we have to refer for reasons of limitations, but I think we all want to see people get back to a state of health that is equal to, if not better than that prior to the diagnosis. So we are glad to have Diana and the whole team at Performance PT to help us. I'll just ask one more time, any other questions from the group? Well, thank you again, Diana. This has been great. Wonderful job.
Thank you for having me.
Okay. See you.
Thank you.